Hey, NICU parents, how are you doing? I hope you're keeping all right. I hope you're keeping strong. I'm Daniela, founder of the Neonatal Foundation, and today I would like to talk about Kangaroo Care. I'm sure most parents have heard of Kangaroo Care, but for those who do not know, Kangaroo Care is when you have a skin to skin contact with your baby. Okay? So your baby is born early or your baby is ill. You don't have that contact with the baby all the time because the baby is in the hospital, either in the incubator or in a cot. So what do they suggest you do? One is to have Kangaroo Care. It's quite important. I'm going to demonstrate what that does. I'll be using my teddy. Okay, so for Kangaroo Care, you have to put your baby in your chest. It's skin to skin. Your baby will be completely naked except for the nappies, and then you also would have to wear a shirt or a kind of top that will enable you take off the buttons and have the skin to skin contact. Okay, it's skin to skin contact, and it is so important for you and your neonate. Now, why is it important and what are the benefits? One, it helps regulate temperature. Most babies born prem can hardly regulate their temperature, but when they're on you, your temperature kind of ignites theirs and helps to regulate it. So it's so important that you do it every opportunity you have. It's not just for moms, even dads can do Kangaroo Care. Okay, so don't think it's a mom thing only. Dads can also perform the kangaroo cuddle. Now, another benefit of the Kangaroo Care is that it helps breathing. It helps regulate the baby's breathing. When a baby is away from the parent, both the mom and the child, they do feel a bit of detachment. But when there's that Kangaroo Care and there's that skin to skin, the sound of your heartbeat, which your baby already recognizes and knows from the time they were in the womb, helps the baby to remain calm. That calmness helps the breathing. So the baby breathes better because the baby is relaxed, and then there's more oxygen circulation. So it increases the oxygen saturation. It also helps the baby to latch onto your breast. As a mom, the babies come early, or even if they're in the hospital, they don't know you really. They don't know your smell. They don't know how to latch onto the breast. So when you have Kangaroo Care, they kind of start getting used to your skin, your body, and it's easy to make breastfeeding a smooth transition, okay, for the baby. So those are the benefits for the babies. Now, what are the benefits for the parents? One, I would say, is bonding. Everyone expects to have a bond with their baby. You have your baby, you take your baby home, you're almost cuddling your baby all the time, okay? But when the baby is in the hospital, there's a little bit of detachment. And to get you reattached to your baby, or to make you feel somewhat that connection again, Kangaroo Care is very important, okay? It also, another benefit is breastfeeding. When you do the Kangaroo Care, you have that sense of, I'm a mom, this is my baby. And then those hormones and whatever emotions and feelings helps the breast milk to let down. So that's another benefit. It also helps relieve stress. Trust me, this one I know firsthand. And I didn't even get the satisfaction from having a preterm baby. It was my baby. I had full term, and I had so many painkillers because it was a very difficult delivery. So they put betadine, this, that, and all the rest, and I was just shivering from all the drugs, shivering from the pain and everything. And I didn't carry my baby. When they brought the baby, I said no, I didn't want to carry. I gave baby to dad. And I did that, but I was still shaking. And one of the consultants just came and said, carry your baby, carry your baby. So I put the baby on my chest. I did that kangaroo care. Immediately, I felt calm. All my shivering disappeared. So it's not just for the baby, it's also for you. It's so beneficial, okay? So make sure every opportunity you get to the hospital. Please, please do this kangaroo care, okay? Make sure you bond with your baby. Make sure you give your baby the best start. Research has also shown that it improves immunity. And how does that work? One would ask, because I was curious as well. And I found out that because of the bacteria on the parent's body, the baby gets used to those bacteria and is able to fight and ward off bacteria in future. So please make sure you do this every opportunity you have. Some may not have the opportunity because if your baby is intubated or is in a serious condition that they don't want, the baby out, they have to monitor the baby 24/7, then that's fine. But immediately your baby is able to have it, don't hesitate to do it. Mom, dad, go to the hospital with your shirt or something, a kimono, take it off, put your baby on your chest 30 minutes, 15 minutes, for as long as the doctors permit. But make sure you kangaroo. Okay? Take care and see you later.